Hello everyone. I'm Mohammed Hamama, and welcome to your ASCP preparation camp. Today, we're diving into 3 critical malignancies: germ cell tumors, gestational trophoblastic disease, and hepatocellular carcinoma. We'll explore the vital role of tumor markers in diagnosing and treating these cancers. Don't forget to like, share, and subscribe, and let's get started. Germ cell tumors, GCTs, are a type of cancer that predominantly occurs in the testes or ovaries but can also develop in other parts of the body such as the mediastinum and retroperitoneum. Interestingly, they are the most common form of cancer among men aged 20 to 34. This means GCTs don't just affect reproductive organs, they can show up in unexpected areas, making their detection more difficult and critical. So, what makes someone more likely to develop a germ cell tumor? Here's a breakdown of the most common risk factors. 1. Family history. If your family has a history of GCTs, your chances of developing them increase. 2. Cryptorchidism. This refers to undescended testes, a condition that significantly elevates your risk. 3. Testicular dysgenesis. Abnormal development of the testicles can also be a factor. 4. Klinefelter syndrome. Individuals with this genetic condition are more susceptible to GCTs. 5. Previous GCT history. If you've had a germ cell tumor before, there's a higher chance of recurrence. These risk factors highlight the importance of monitoring, especially for those with a known history of any of these conditions. Now, let's talk about the signs you should watch out for. Germ cell tumors don't always make their presence known immediately, but here are some common symptoms that may indicate a problem. Testicular lump, a palpable mass in the testicle, is often the most apparent sign. Lung metastases. If the cancer spreads, it can cause respiratory issues. Abdominal mass. Tumors can also form in the abdomen, particularly in the retroperitoneum. Hyperthyroidism. In rare cases, some germ cell tumors can cause hyperthyroidism, leading to symptoms like weight loss and anxiety. Diagnosis is key, and fortunately, several advanced methods are available for identifying GCTs. These include tumor markers. Blood tests measure levels of AFP, alpha-fetoprotein, HCG, human chorionic gonadotropin, and LDH, lactate dehydrogenase, to help identify the presence of tumors. Histopathological examination, a microscopic look at tissue samples. Radiological imaging, scans like CT or MRI help visualize the tumor's location and size. These diagnostic tools work together to provide a clearer picture of the type and severity of the tumor. Types of GCTs. Not all germ cell tumors are the same. There are 3 main categories. 1. Seminomas. These tend to grow more slowly and respond better to radiation. 2. Non-seminotomous germ cell tumors, NSGCTs. These are more aggressive and may require a combination of treatments. 3. Combined tumors. Some tumors contain both seminomatous and non-seminotomous elements, making treatment more complex. Once diagnosed, there are several treatment pathways depending on the type and stage of the tumor. Surgery, often the first line of defense, where the tumor or affected organ is surgically removed. Chemotherapy, used to kill any remaining cancer cells, especially for more aggressive forms like NSGCTs. Radiotherapy, targeted radiation to destroy cancer cells, typically used for seminomas. Combination therapy, sometimes a mix of surgery, chemo, and radiation is necessary to fully address the tumor. The role of tumor markers in GCTs. Tumor markers like AFP, HCG, and LDH are incredibly important, not just for diagnosis but for monitoring the effectiveness of treatment. By regularly checking these markers, doctors can tell if the cancer is responding to treatment or if it's recurring. Several factors influence the prognosis of someone with a germ cell tumor. These include tumor marker concentrations. Higher levels can indicate more advanced cancer. Primary tumor site, tumors in the testes tend to have a better prognosis compared to those in other areas. Metastatic sites, the more places the cancer has spread, the worse the prognosis generally becomes. After treatment, constant vigilance is required to ensure the cancer doesn't come back. Tumor markers should be measured both before and after surgery and regularly monitored after treatment. This schedule will vary based on the type and stage of the tumor, as well as the patient's risk category. For patients who remain cancer-free for 5 to 10 years, regular follow-ups can eventually be reduced. However, for those treated with platinum-based chemotherapy, there's a risk of long-term side effects like cardiovascular issues, so additional monitoring may be required. The second malignancy is gestational trophoblastic disease. Gestational trophoblastic disease, GTD, develops in the trophoblast cells that surround the embryo shortly after conception. GTD is a group of disorders that can occur after a molar pregnancy, a non-molar pregnancy, or even a live birth. While rare, understanding this disease is crucial because it can be life-threatening if not caught early. The symptoms of GTD can vary depending on the type and severity of the disease, but here are some of the most common signs to watch for. Hyperemesis, excessive vomiting that goes beyond typical morning sickness. Excessive uterine enlargement, more significant growth of the uterus than expected for the stage of pregnancy. Irregular vaginal bleeding, persistent bleeding that can occur after a pregnancy. Early failed pregnancy, GTD can sometimes lead to a failed pregnancy early on. Hyperthyroidism, symptoms like weight loss, rapid heartbeat, and anxiety may also appear in some cases. Early onset preeclampsia, high blood pressure occurring earlier than usual during pregnancy. Abdominal distension, caused by the formation of theca lutein cysts. These symptoms should not be ignored and require immediate medical attention if they occur. GTD isn't a single condition, but a group of diseases that vary in severity. Let's go over the main types. 1. Hydatidiform moles, molar pregnancies. These are abnormal growths that form in the uterus after fertilization. 2. Invasive moles, molar pregnancies that grow deeper into the uterine wall. 3. Choriocarcinoma, a fast-growing cancer that can spread to other parts of the body. 4. Placental site trophoblastic tumors. These are rare tumors that occur at the site where the placenta attaches to the uterus. Each type presents unique challenges and requires different approaches to treatment. A key part of diagnosing and monitoring GTD is the measurement of HCG, or human chorionic gonadotropin. This is a hormone produced during pregnancy, but in the case of GTD, HCG levels are often abnormally high. HCG is a tumor marker that's highly specific and sensitive for GTD. It's critical for diagnosing the disease, assessing its severity, and monitoring recovery or recurrence. HCG can be measured in both blood and urine, making it an essential tool for early detection and ongoing care. Accurate diagnosis is crucial for effectively treating GTD. Doctors typically use a combination of the following. Histological examination. This involves studying tissue samples under a microscope to definitively diagnose GTD. HCG serum concentrations. High levels of HCG can help diagnose molar pregnancies. Ultrasound scanning. While not definitive, ultrasounds can provide useful information on the size and nature of the growth in the uterus. By using these tools together, doctors can form a complete picture of the disease and plan the appropriate treatment. The good news is that GTD is highly treatable, especially when caught early. Here are the main treatment options. Surgery. The first step is often surgery to remove the mole or tumor from the uterus. Chemotherapy. If the disease is more invasive, chemotherapy can be used to destroy cancerous cells. HCG monitoring. Continuous monitoring of HCG levels is essential to ensure that the treatment is working and that there's no recurrence of the disease. Each case of GTD is unique, so treatment plans are tailored to the individual's needs. The prognosis for gestational trophoblastic disease is generally favorable, but it varies based on the type and extent of the disease. The International Federation of Gynecology and Oncology, FIGO, staging system is used to assess prognosis, with one of the key factors being pretreatment HCG concentration. Women with higher scores in the FIGO system, particularly those with scores of 7 or higher, are considered at high risk for recurrence. These high-risk patients usually require intravenous multi-agent chemotherapy to reduce the likelihood of the disease returning. Even in high-risk cases, GTD can often be successfully managed with modern treatments. After treatment, regular monitoring is vital to ensure the disease doesn't come back. Here's how the monitoring schedule typically works. Serial HCG measurements. Both blood and urine tests are used to monitor HCG levels after treatment. 6-month monitoring. Monitoring usually continues for 6 months after the date of uterine evacuation or once HCG levels return to normal. Future pregnancies. Women who have had GTD in the past are advised to notify the screening center if they become pregnant again, so their HCG levels can be closely watched. This careful follow-up ensures any recurrence of GTD is caught early and treated promptly. The next step is hepatocellular carcinoma. Hepatocellular carcinoma, or HCC, is a type of liver cancer that starts in the hepatocytes, which are the main functional cells of the liver. HCC is now the 6th most common cause of cancer death worldwide. It's particularly more common in men, and what's alarming is that its incidence is steadily increasing across the globe. Certain risk factors greatly increase the chances of developing HCC. These include 1. Chronic hepatitis B or C infection, HBV or HCV. Both viruses cause chronic liver inflammation, leading to an increased risk of liver cancer. 2. Aflatoxin B contamination. Eating food contaminated with aflatoxin, a substance produced by molds, can lead to liver damage and cancer. 3. Alcoholic cirrhosis. Excessive alcohol consumption leads to liver cirrhosis, which can eventually develop into cancer. 4. Inherited metabolic disorders. Conditions like hereditary hemochromatosis, porphyria cutanea tarda, and alpha-1 antitrypsin deficiency increase HCC risk. 5. Wilson disease, a genetic disorder that causes copper accumulation in the liver. 6. Primary biliary cirrhosis, particularly at stage 4, this condition causes chronic liver damage. 7. Metabolic syndrome or diabetes with NASH, non-alcoholic fatty liver steatohepatitis, NASH, linked to metabolic syndrome or diabetes is another significant risk factor. These risk factors highlight how both viral infections and lifestyle-related liver conditions can significantly increase your risk of developing liver cancer. Hepatocellular carcinoma often progresses silently until it becomes severe, but some common symptoms include jaundice, yellowing of the skin and eyes due to liver dysfunction. Hepatomegaly, an enlarged liver, often detectable by a physical exam. Ascites, fluid buildup in the abdomen, causing visible bloating. Peripheral edema, swelling in the legs and feet due to fluid retention. Pruritus, persistent itching, often linked to liver issues. Bleeding esophageal varices, these are enlarged veins in the esophagus that can rupture and cause life-threatening bleeding. Right upper quadrant pain, pain in the upper right area of the abdomen, where the liver is located. If you're experiencing any of these symptoms, it's crucial to seek medical advice immediately. To accurately diagnose HCC, doctors rely on a variety of methods, including histological examination, ultrasound scanning, CT or MRI scans, alpha-fetoprotein (AFP) measurement. Each of these diagnostic tools plays a role in confirming HCC and determining its stage. Alpha-fetoprotein (AFP) is an important tumor marker used to screen, diagnose, and monitor HCC. Elevated AFP levels can indicate liver cancer, but it's also important to note that AFP may be raised in non-cancerous conditions like liver damage or regeneration. Screening. High AFP levels in blood tests can flag potential liver cancer in high-risk individuals. Diagnosis. Alongside imaging, AFP helps confirm the presence of HCC. Monitoring. Post-treatment, AFP levels are checked regularly to ensure the cancer has not returned. Treating hepatocellular carcinoma depends on the stage and location of the tumor, as well as the patient's overall health. Here are the main treatment options. Liver transplantation, surgical resection, ablative therapy, chemoembolization, chemotherapy. Each treatment has its pros and cons, and doctors will often recommend a combination based on the individual patient's needs. The outlook for HCC varies depending on how early the cancer is caught. Here are some key survival rates. For patients with cancer confined to the liver, the 5-year survival rate is around 43%. If the cancer has spread to regional lymph nodes, the 5-year survival rate drops to 11%. For patients with metastatic disease, meaning the cancer has spread to distant organs, the 5-year survival rate is less than 5%. This makes early detection and treatment crucial for improving outcomes. Importance of screening for HCC. Screening high-risk populations can significantly improve outcomes. Early detection enables curative treatments like surgical resection or liver transplantation. Screening is especially important for individuals with cirrhosis due to HBV or HCV infection, people with genetic hemochromatosis or primary biliary cirrhosis. Don't keep this valuable information to yourself, share it with friends who might find it helpful. If you have any questions or comments, drop them below. We love hearing from you and will do our best to respond to everyone. For even more insights, grab our ASCP short notes linked below. Hit that subscribe button so you never miss our next dive into the fascinating world of science. And don't forget to check out our store, it means a lot to us.